A multidisciplinary approach to patient rounding has been initiated here at Kaiser South Sacramento. It is a collaborative team of HBS physicians, registered nurses, and patient care coordinators who will conduct bedside patient rounds according to a standardized protocol on 100% of medicine patients on the medical surgical floors. Our goal as a team is to improve the patient's understanding of their illnesses, their treatment plans, and at-home plans of care. Multidisciplinary rounding will focus on the plan of care for the patient over the next 24 hours, as well as including discharge plans. The nurse, who will be collaborating with the physician, and the patient care coordinator will be prepared to discuss the last 24 hours of changes in the patient condition. The expectation is for rounds to occur between 0900 and noon every day. Upon arrival on the unit, the physician will notify the nurse directly of rounds with their respective patients within 5 to 10 minutes. If the nurse expects to be tied up for an extended period of time, the charge nurse or assistant manager will facilitate coverage to ensure that rounds begin on time. The physician and the patient care coordinator conduct an initial briefing with the nurse prior to entering the patient's room. This initial meeting is to discuss anything that needs to be discussed outside of the patient's room, for example, if it was a 2-bed room.
Julie!
Good morning, Dr. Fan.
Good morning, Julie.
Hi.
Debbie and I are going to round with you on your patient today, Mrs. Crawford.
Okay, I'm ready to round with you right now.
All right, but before we come in, is there anything you would like to talk to me outside of the room?
Not at this moment.
Okay, let's go then.
After completion of the initial meeting outside of the room, the next phase of the multidisciplinary rounding is the in-room meeting with the patient and the care team. Upon entering the room, the physician will explain to the patient the purpose of the visit and also introduce the team members to the patient at this time. The staff nurse will bring a mobile cart with him or her into the room and discuss the last 24 hours events using SBAR.
Our discharge planner.
Good morning, Mrs. Crawford.
Good morning, nice to meet you.
Nice to meet you.
So, Mrs. Crawford, today we are going to be discussing your condition as well as your plan of care for today and any other concerns that you may have. Okay? And so, how are you doing today, Mrs. Crawford?
I'm okay, but I was telling Julie that my stomach still bothers me.
Okay, so this is our patient, Mrs. Cindy Crawford. She came in last night for abdominal pain and weakness. Her vital signs were stable overnight, and Mrs. Crawford's main complaint was mostly about pain control. She's still in pain despite 2 milligrams of morphine twice already on my shift. The labs that were drawn this morning indicate that her potassium level is low at 3.1. We've kept her on NPO since last night, and the CT scan that we ordered for her is scheduled for 11 o'clock this morning.
Okay.
I already told Mrs. Crawford that, and it's already written on the care board to remind everybody about that schedule. Just a question, did you want us to replace her potassium and maybe check in on her pain medication?
Oh, sure, yes. Mrs. Crawford, since your potassium was low, I am going to give you the potassium through your IV today.
Okay.
And besides that, I will also increase your pain medication frequency. I believe it's going to be 2 hours, every 2 hours for now, only as needed, of course. And I also would like to keep you NPO, meaning that, you know, except medication, you won't have anything else. No food, no fluids. Is it okay if I assess you right now?
Let me help you.
In this final scene, you will witness the clarification step as it occurs inside the patient's room. The plan of care is established, orders are clarified, and patient questions are answered. New orders will be written, and clarification on any unclear issues will be finalized between the physician and the team.
So, you know, our plan for today with you is to control your pain, of course, and to replace your potassium, and we're gonna get the physical therapy evaluation for you, along with getting the CT scan, and that's gonna be done at 11 o'clock. So the goal is not to give you anything by mouth until the CT is in. Okay. Other than that, are there any other questions or concerns you may have had for me at this time?
Nothing at this time. You have answered all my questions. It's been great to have the chance to talk to the whole treatment team, so I know what to expect while I'm here in the hospital.
Okay. So, but I'll be checking on you a little bit later on today too.
Okay. Thank you.
Okay, and I'll stay a few minutes just to go over some more information with you.
Thank you, Mrs. Crawford.
So, you know, I'll put in the orders, and you call me if you have questions for me.
Certainly, Dr. Fan. Thank you.
Okay. Thank you.
All right. The team communication, what?
The registered nurse will document the plan of care on the team communication and patient notes. This will be part of the handoff process during change of shift. The multidisciplinary rounding has shown to reduce paging from nurses to the physicians, improve the feeling of involvement from the patient's perspective, and improve the care process for the patient as well as the staff. As Kaiser's South Sacramento works to become a world-class hospital, multidisciplinary rounding will be one of the key attributes paving the way.